Hi guys, today it's all about the different techniques of injecting filler in the lips and exactly what to expect if you have it done for the first time. I'm going to tell you exactly what to expect if it's the first time that you were having lip fillers, if you wanted to have it for a while, but you never had the courage because of the unknown, you just don't know what to expect. Well, I'm going to tell you exactly what to expect. And also, I'm going to show you the different techniques and talk you through what I personally use and how you can have your lips done. So, let's dive straight into the technique. So, whenever we inject filler in the lips, first of all, it has to be ideally hyaluronic acid based or HA. What basically that means is a component of the filler that your body is able to break it down. So it's a temporary filler, it's not permanent, it is not silicone, that's not safe anymore. It just, we inject it and your body slowly breaks it down over a period, could be anything between 3 and 12 months. It depends on your metabolism, depends how often you exercise, and also if you had any previous collagen injected. So absolutely has to be hyaluronic acid. Then we can inject it either with a needle or with a cannula. So I think it's a little bit of personal preference. So some practitioners have been using needle for years and they love it. Some other ones, they just prefer the cannula. Well, I say I use both and it depends on the case. So for example, the needle, you all know how a needle looks. So it's really, really sharp. It's my favorite way to inject if I have to lift the cupid bow, which is the little triangle that we have on the center of our top lip. It works really well by creating the philtrum, elevating the cupid bow to give you a really nice heart shape of the lips. And actually, I use the needle in people that have M-shaped lips. So what is it? So the M-shaped lips are a very, very tricky shape of lips where the upper lip almost flips on the inside, curls on the inside. So you my patient complains, oh, I don't have a top lip. You just look very, very thin, especially when you smile or when you talk, it becomes almost non-existent. So likely have M-shaped lips. In that case, sometimes with the cannula, it's tricky to give the volume. So we have to inject with the needle in different direction to kind of stretch and elevate your mucosa. And in that case, you might need several sessions. But if you're not sure, come and see me, send me your photos, and I can advise you whether you have those lips. In that case, I use the needle more. Or my favorite and safest technique to inject is actually a cannula. So the way it works with a cannula, and you still use a needle first to do a tiny, we call it the entry point. So a tiny pinprick to almost create like an access to your skin. Then what we do afterwards is to use a cannula. So the cannula looks like a needle, can you see? It's very long, but if you look closely, at the tip, it's not sharp, it's completely blunt. So it looks like a probe. So in that way, as you can imagine, how it's much safer because it doesn't cut the tissue, just glides through. So in that way, we don't traumatize the tissue, so much less risk of occluding a vessel, which means blocking the blood to go into your tissues, which is one of the main risks of lip fillers. It's called vascular occlusion. So we block a vessel so the tissues don't have blood anymore, they start to die, and then it becomes necrosis. Can be reversed with something called hyalase, but still it's not nice to go through that. So this reduces the amount of chances of getting that. And also the good thing about this is that you have much less bruising. You only have one pinprick with the needle at the corner of the mouth, so much less bruising. Literally no one can really tell that you had your lips done. So what can you expect when you have your lips done, especially for the first time? So I would say the lips is the area that you really cannot hide. So if your partner is against lip fillers, if your husband doesn't want you to do it, then maybe it's the time where you just want to do it when you know that you have about a week or 10 days of safety, because the lips will swell up. You have swelling, you might have bruising. If you use a cannula, much less bruising, but the swelling is inevitable. The lips are so thin, they're so sensitive, so you will have swelling for, I would say, the worst is the first 24 hours, then 72, and then a week. But it will take a good 2 weeks to see the final result. So how you're gonna feel? So you're gonna feel numb at first. So you're gonna have some really strong numbing cream that I normally apply, and the filler actually contains the anesthetics. So for a couple of hours, you will feel pretty numb. That's absolutely normal. Avoid after injection to have any hot drinks or any soup. You don't want to have any heat on your lips. So cold ice is perfect, or like ice cream, or just anything that doesn't require you to bite. So perhaps sandwich is not a good idea. Then what you can do is to take some arnica tablets to reduce the swelling, get some ice packs or some peas into your fridge or freezer that just help to reduce the actual swelling, and just wait. For the first week, your lips may feel swollen, they may feel like actually also hard. It's all normal as well. And sometimes also lumpy, because the molecule of hyaluronic acid will attract the water from your face. So they will expand, they will feel hard up to day 14, 15, when they slowly release the water, and then it's the turning point where your lips start to feel really nice, soft, and totally yours. So you don't feel the filler once it is mixed with your own collagen as well. And then again, it lasts anything between 3, 6, 12 months, also depending on your metabolism. If you want to have really improvement on your lip size, I normally never inject more than 1 ml at a time because of risk of lumps. So I would say just have maximum 1 ml. If you want to have a good amount of volume, maybe just have the treatment every 6 weeks until you reach the size that you're happy with. So that will be the best in terms of safety as well. So I hope this was super helpful, and I hope this answers some of your questions about lip fillers. So if you have any questions, just let me know. Otherwise, please like my video, subscribe my channel, and thanks for watching.